This is Gina from RN2 Professors with a video for you for my OB series on labor and birthing process. In this video, I'm going to review questions on the labor and birthing process. These questions will focus on the stages of labor and the interventions that we do during those stages. I will go through each question with you and give you the rationale for the correct and incorrect answers and help you better understand what the question is asking. Here's our first question. The onset of labor is multifactorial. These reasons include which of the following? Select all that apply. 1. Increase in progesterone. 2. Increase in estrogen. 3. Increase in human chorionic gonadotropin. 4. Aging of placenta. 5. Fetal hormones. 6. Decrease in prostaglandins. This is an application question. To answer this question, you need to know what the signs of onset of labor are. This is also a select all that applies question, so you need to look at each answer individually to see if it fits the question. Number 1, increase in progesterone. This is not a correct answer. Progesterone decreases prior to labor. Number 2, increase in estrogen. This is a correct answer. Estrogen does increase prior to labor. The increase of estrogen with the decrease of progesterone makes the uterine smooth muscles more sensitive to stimuli that promote contractions because the progesterone no longer inhibits them. Number 3, increase in human chorionic gonadotropin. This is not a correct answer. Human chorionic gonadotropin is not elevated at the end of pregnancy. Number 4, aging of placenta. This is a correct answer. The placenta ages as pregnancy progresses. Number 5, fetal hormones. This answer is also correct. The fetal hypothalamic pituitary adrenal axis has an effect on the beginning of labor. Number 6, decrease in prostaglandins. This is not a correct answer. Hormonal changes that occur prior to labor are increase in estrogen and prostaglandins with a decrease in progesterone. Number 2, 4, and 5 are the correct answers to this question. Here's our next question. An infant was born 1 minute ago. The APGAR score is being assigned. The infant has blue extremities, minimal flexation, a weak cry, a heart rate of 110 beats per minute, and coughs and pulls away with suctioning. How many points should be assigned? This is an analysis question. To answer this question, you need to recall the points assigned to the 5 categories of the APGAR score. Let's go through them together. The baby's extremities are blue, which equals 1 point for the color category. Minimal flexation of extremities or sluggish movement gets 1 point for muscle tone. Slow, irregular respirations or weak cry gets 1 point for respiratory effort. 100 beats a minute or higher receives 2 points for heart rate. And active motion, which is sneezing, coughing, or pulling away, gets 2 points for reflex response. So that equals 7 points for the APGAR score. And that is the answer to this question. Here's our next question. A 35-year-old Gravida 1, Para 0, is admitted to the labor and delivery unit. She reports intense rectal pressure. Which stage of labor is probable? Number 1, first stage latent. Number 2, second stage. Number 3, third stage. Or number 4, fourth stage. This is an analysis question. To answer this question, you need to review the 4 stages of labor and what occurs during those stages. Number 1, first stage, latent phase. This is not the correct answer. In the first stage, latent phase, rectal pressure is not usually felt because the fetal head has not yet reached the pelvic floor. Number 2, second stage. This is the correct answer. In the second stage, the urge to push is much more intense as the fetal head reaches the pelvic floor. Number 3, third stage. This answer is incorrect because the third stage of labor is the delivery of the placenta. Number 4, the fourth stage. This answer is not correct because the fourth stage is the period after delivery when homeostasis is being established. Number 2 is the correct answer to this question. Next question. On admission to the labor unit, a prima gravida woman at 38 weeks gestation states, "I need to urinate more now, but at least I can breathe easier." The nurse is aware that this is likely due to which physiological process? Number 1, the onset of labor. Number 2, effacement. Number 3, lightening. Or number 4, the rupture of membranes. This is a comprehension question. To answer this question, review the signs of impending labor. Number 1, onset of labor. This answer is incorrect. These are not signs of the onset of labor. Number 2, effacement. This answer is incorrect. Effacement is thinning and shortening of the cervix and does not affect pressure on the bladder. Number 3, lightening. This is the correct answer. Lightening occurs when the fetal head descends into the maternal pelvis, causing decreased pressure on the rib cage and increased pressure on the bladder. This creates increased ease of breathing and urination frequency. Number 4, rupture of membranes. This answer is incorrect because lightening may not be related to the rupture of membranes. Number 3 is the correct answer to this question. Here is our last question. A fetus is in the occiput anterior position. During the cardinal movement of extension, which events are occurring? Select all that apply. Number 1, the fetal head lines up with the pelvic outlet. Number 2, the occiput passes under the symphysis pubis. Number 3, the fetal head is engaged. Number 4, the head is delivered. Number 5, the fetus is progressing through the pelvic inlet. This is a knowledge question. To answer this question, you need to review the 7 cardinal movements of labor. This is also a select all that applies question, so make sure to look at each one individually to see if they fit the question. Number 1, the fetal head lines up with the pelvic outlet. This answer is correct. During extension, the fetal head lines up with the pelvic outlet. Number 2, the occiput passes under the symphysis pubis. This answer is correct. During extension, the fetal head lines up with the pelvic outlet and then passes under the symphysis pubis. Number 3, the fetal head is engaged. This answer is not correct. Engagement occurs earlier than extension. Number 4, the head is delivered. This answer is correct. During extension, the fetal head lines up with the pelvic outlet, passes under the symphysis pubis, and is delivered. Number 5, the fetus is progressing through the pelvic inlet. This answer is not correct. The fetus passes through the pelvic inlet during the descent. Numbers 1, 2, and 4 are the answers to this question. Thank you for joining me today. I hope that you got some great information from this video. If you liked it, please subscribe for free. Click the bell on the bottom to get notifications when new videos come out. And come join our Facebook page at RN2 Professors for more material, quizzes, and live reviews.